my channel. For our new subscribers, thank you for joining this platform. Here, we talk on faith, principles, and medicine. And my name is Dr. Frederick Acquah. Currently, I'm a third-year internal medicine chief resident in New Jersey. Here with me today, I have my irreplaceable wife. You've met her before in the video, Married to Medicine. You could check out the link up here. And as you can see, the apple did not fall too far from the tree. I have here with me my first son, Jeremiah. And he'll be asking us some questions as we go. Say hi, guys.
Hello, family.
Every individual with a womb meant to carry a fetus after conceiving need to be mindful of certain hiccups that may occur during the expected 9 months of pregnancy. Knowing your risk factors also limit the anxiety during the time period, as it decreases your threshold of getting in touch with your obstetrician. I've been praying to have a daughter after we were gifted with 2 boys. Needless did I know what was before us. We testify to the grace of God for keeping both mother and baby alive to tell the story. We'll hear from the horse's own mouth today, and I will speak on pulmonary embolism. You ready? Let's go.
Welcome back. So what is pulmonary embolism and possible symptoms?
So pulmonary has to do with things of the lung, and embolism is just a clot traveling from somewhere in your body to a place that it's not supposed to be. So it's coming to the vasculature of the pulmonary system. So that's why it's called a pulmonary embolism. Now, what symptoms can you get? I think that's what you did ask me, right? So when it comes to symptoms, people may have increased heart rate. They will have shortness of breath. They will begin to have chest pain. Sometimes, if the source is from the leg, which is a deep vein thrombosis, DVT, someone will have a swollen leg, maybe either the right leg or the left leg. It could be swollen. They may have some pain, and that will bring them to the hospital to come and see a doctor. So these are the common symptoms that people do have.
So Mom, do you have any pulmonary embolisms?
Yes, I did.
Do you have any symptoms?
Yes, I had symptoms. The only symptoms that I had was trouble breathing.
So Mom, tell us the whole story.
Alright, so throughout when I was pregnant with Jaisa, I was having, tiredness and a little shortness of breath. But in the beginning, I thought it was because I wasn't eating much and I was losing weight. But the day it actually started was one night. Dad was going to work. He was on a night shift, and you guys were with Grandma and Grandpa. So I was laying down, I was sleeping, and I woke up from my nap to get ready for work, and I couldn't catch my breath. I was so out of breath. So Daddy was actually getting ready to go to work, and I was telling Daddy, I was like, I'm so out of breath. I feel like I'm so tired. I don't know why that's happening because I'm just waking up from sleep. And Daddy was like, oh, you're probably just tired. Just, go back to sleep for a little bit. So I did go back to sleep for a little bit. And, Daddy got ready and he left. So when I got up to get ready to go to work, still, I couldn't. But I was like, there's nobody home. If I decide to, stay home, call out of work, and something happens, Daddy's not going to be able to help me. There's nobody here. So I'm going to try my best to go to work. So I did. I tried my best. I could barely make it from here to the elevator, even from the elevator to the car. I did my best. I prayed to God and I made it to work. So when I got to work in the elevator, I was like huffing and puffing. I couldn't catch my breath and everybody was asking me, what's wrong with you? What's wrong with you? I'm like, I think I'm gonna go to the emergency room. And at this point, I'm thinking, I just probably need some nutrients, some fluids because I feel like I was dehydrated probably from not eating. So I called my OB and she said, yes, go to the emergency room. I got there. I drove myself to the emergency room. I told Daddy first. I got there. I couldn't even speak or tell them exactly what was happening to me. I was just telling them I'm pregnant and I just can't catch my breath. So right away they wheeled me in, and I always thank God for the medical team, the doctor, the resident doctor that diagnosed me, that called I think his name was Dr. Mark something. God, I always thank God for them. They started running tests, everything was coming out negative, and he was like, I want to find out why you're still out of breath, so I'm just gonna do a CT scan if that's okay. I wanted to tell Daddy, but he was busy because he was on night call, and I couldn't really get reach of him. But I did tell them to go ahead because at this point it's my life. So it came out and it was positive for blood clots, and it was already in my lungs, and everything went crazy from there.
So how did you feel as a doctor and husband?
Well, I had mixed feelings. They always say that spouses in the medical field, sometimes things happen and it comes out really bad. So I was not surprised when mom called me when she was in the emergency department with what was going on. She tried, but unfortunately I was busy admitting patients, so I got in touch with her, and she told me she had pulmonary embolism. I was sad because I do treat people that come to the hospital for the same thing, but then it gets more complicated when that person is pregnant, because now you have two lives. If you don't save mom's life, you may lose mom and lose the baby. And I think it was sometime in July, and I think you're only 3 months in.
First trimester.
Yeah, first trimester, and this happened. So I was a little worried, but I kept my faith in God during this process.
Yeah.
Dad, what are the risk factors?
When someone is pregnant, there are hormonal changes that occur. Every pregnant woman becomes hypercoagulable, meaning they are likely to clot compared to another female who is not pregnant. When it comes to every other person, sometimes risk factors as in clotting history, maybe they have a family history. I'll be listing things that increases someone's risk of getting pulmonary embolism.
Dad, how did you diagnose pulmonary embolism?
When it comes to diagnosing pulmonary embolism, it's different when it comes to pregnant women. Pregnant women, they have a fetus, aka a baby growing in their womb, and exposing them to radiation is not a good thing. So the best thing for us to do is that we need to do certain studies that limit the amount of radiation. If all tests has been done and we still have an increased suspicion for that diagnosis, then mother needs to sign a consent. Told to sign a consent.
Yeah, that's what I remember. I was saying I called you before I wanted to sign the consent to let you know. But then I couldn't reach you, so I just told them, okay, I signed it.
Yeah, so with her case, she did sign a consent, and she got a CTP protocol done in the ED, and that's how they found the pulmonary embolism. When someone has a pulmonary embolism, you have this clot that lodges up in the pulmonary vasculature. Now, imagine your heart trying to pump against that amount of resistance. You have that clot in there, your heart is trying to pump. Most likely, the right side of your heart is going to get tired, right? It's going to need to work against that resistance. So there's something called a right heart strain. So a right heart strain can happen, and we can see that on an echocardiogram, which is an ultrasound of the heart. We can get some markers like troponin, which could be elevated, BNP, which it can also be elevated. One thing that we also look at is the patient's vitals. Most of the patients that come in with pulmonary embolism will have something called sinus tachycardia, meaning their heart rate is elevated. There's some people that will come with a low blood pressure. When we see that low blood pressure, that adds up to the severity of the patient's disease process. And there are different classification or different categories of pulmonary embolism. I'll leave a link in the description box below so you guys can see what I'm talking about.
So Dad, how do you treat this?
So when it comes to treatment, we have to go back to the foundation. The main issue here is that someone is clotting. We give a medication that is going to block the clotting cascade to prevent that patient from clotting more than what they've done so far. So the main medication that we usually use firsthand will be heparin. We put someone on low molecular weight heparin, and I think that's what they had used for you initially.
Yeah, they gave me heparin in the beginning.
And I think that's also safe when it comes to pregnancy. Yeah, so they put someone on heparin, and then later on they transition that person to a different medication. So for pregnant females, usually they want to go with Lovenox weight base. So you have to inject yourself 2 times daily, one in the morning and one 12 hours later, usually at night. But the non-pregnant patients that come to the hospital that I see, usually after we diagnose it, sometimes we can start them on a loading dose of an oral medication, and then they can go home and continue on that oral medication.
Yeah.
So, Mom, did you have to follow up with someone?
Yes, I did. I had a hematologist. That's like a blood doctor, to see if my weight and the dose that they gave me was good and it was therapeutic.
All in all, it's my wish and my hope that no pregnant woman will go through this. To the husbands out there, it can be scary, especially if you're at work and you get a call from your wife that, hey, something like this is happening. So if you're pregnant and you're feeling short of breath, you're not feeling okay, you're feeling different, please do your best to call your OB, and most likely they'll give you the advice. Just so everyone knows, I'm not an OBGYN doctor. This was our experience as a family, and we wanted to share with everyone. Guys, thank you for staying tuned to the end. We'll see you in our next video. Shalom.
Welcome back.
Good.
Okay, let's try again. 3, 2, 1. Welcome back. So what is pulmonary?
You're asking Daddy. So you look at Daddy. Ask Daddy.
Welcome back. So how did you feel about being a doctor/husband?
If they still need to be on that oxygen or not. Hematology, oncology, their job will be to work someone up to figure out exactly why they're clotting.
Can I go to sleep now?
Yeah, go. Done. Go.
Yeah.